Kay says, I'm a 62-year young female with no breast cancer issues. My doctor is insisting I get an annual mammogram. I'm concerned about EMF exposure. How safe are mammograms? What's the safest type?
Mhm. Yeah, that's a great insight and a great question. I think mammography can have a place, but I do agree that it is not without risk and it can be, in my opinion, overused. Um, there are some technologies that I hope that can become more popular that use ultrasound first as a screening technology. And then, I do think potentially, a baseline mammogram for women at some point could be helpful, especially if you're going to do hormone replacement therapy and so forth. But again, I am in full agreement that I do think they're overprescribed, overused, and there's a lot of other technologies that we should be using to help women navigate, breast cancer prevention.
I fully agree. So if there's no history of breast cancer in your family,
Mhm.
and if you're really concerned, you might do the genetic test to see if you carry the genes for breast cancer. And if there's no indicators of a genetic vulnerability and no family history, then I would ask your doctor, it sounds like he is a male, I would ask him, does he do a testogram every year? Is he doing radiation to his testicles every year to see, are there any problems? Or is he even having them palpated every year?
Mhm.
Throw it back at him. And yes, well, of course not. Well, so I agree with Dr. Schaffner. She's so much more delicate at explaining that the overuse of mammograms is really terrible. Now, if you have a family history,
Mhm.
if you have genetic vulnerabilities, that's a different discussion.
Mhm.
Or if you have a history of fibrocystic breasts, that's a
Mhm.
different discussion. But if there's no history, no risk markers whatsoever, as your questions stated, then I would have a hard time agreeing with that recommendation.
Mhm.